Okay, so hello everyone once again. My name is Rina Mehmeti and I'm the Vice President of National Working Groups at InciSioN. Thank you so much for joining today's webinar on surgical system post-COVID-19, the path towards recovery. I want to start by saying and wishing everyone a happy Global Surgery Day. Today, more than any day of the year, we advocate for safe, timely manner and affordable surgical care all around the world. This day, the Global Surgery Day, has been celebrated from InciSioN since 2015 in the light of passing of the WHO resolution, WHA 68.15, strengthening emergency and essential surgical care and anesthesia as a component of the universal health coverage. I want hereby to also thank our amazing panelists that we have with us today. And I want to thank all the participants and all the global surgery enthusiasts that have joined us today. I am sure that today we will have a very insightful and fruitful discussion on this very important topic. And today I will have the great pleasure to also co-moderate this webinar with my amazing colleague and friend, the Vice President of Internal Affairs at InciSioN, Makinah. Makinah, I'll pass the mic to you.
Hi everyone, thank you so much for joining us here today. We're really excited to have you on board and we're super excited to hold this webinar as well. Just wanted a quick reminder that I think it's actually quite fitting that last year in 2020 was the very first Global Surgery Day InciSioN ran since its inception, where we had just started experiencing the COVID-19 pandemic worldwide. And I think it's incredibly fitting that in this current Global Surgery Day, we'll be focusing on, hopefully, the pandemic in the presence of it being seen in the past and looking at those effects and hopefully moving forward a much more hopeful future in regards to global surgery overall. And with that, I think we should probably start with the introductions before we move on to a very exciting panel discussion, and we can open up the floor to you as an audience to ask your questions as well.
Definitely. Thank you so much, Makinah. As you said, before the discussion begins, we will start with short introductions. And I would like to start with my amazing co-moderator. Makinah is a medical student at King's College London, currently pursuing an intercalated degree in biomedical engineering at Imperial College London. She was a class of 2019 campus director and Millennium Fellow, a program run jointly by the Millennium Campus Network and United Nations Academic Impact, in which she developed her initial interest in the area of global equity and the ethics. From joining the 2020 InciSioN International Education Team, Makinah is now the 2021 Vice President of Internal Affairs and hopes to expand the organizational development of InciSioN to continuously empower students, trainees, and early career physicians within global surgery. She is also part of the WFNS Global Neurosurgery Secretariat Committee. She is also a medical education and technology fellow at Medics Academy. Her interests lie in global neurosurgery, medical education, and healthcare equity. The mic's to you.
Yes, thank you so much for such a kind introduction, Rina. And I have the immense pleasure of being able to co-moderate with our fantastic Vice President of National Working Group, Rina Mehmeti, who is a final year medical student at the University of Pristina, Kosovo. Her journey with global surgery started in 2019. She was Secretary General and later the head of the Global Surgery Organization of Kosovo, known as GSOK, Students Committee for 2 years. In early 2020, she became part of the research subteam at InciSioN and expanded her responsibilities within the organization by assuming the role of VP of National Working Groups. She's been part of a number of other national and international organizations with a focus on education research in 2018, such as We Speak Science, Students for COVID, and etc. Rina has been awarded the Perseverance Rover Prize this year for her continued effort and work for 2 years to promote and achieve the mission and vision of GSOK despite difficulties and for inspiring young generations. She is currently interested in research and innovation within the field of global health. And now moving on from our co-moderator and I'm very excited to be introducing our panelists today, who have very kindly given up their time to discuss the impact that COVID has had in their countries and the lessons moving forward, as well as looking at the impact this may have long term. And first and foremost, our first speaker, who is the chair of one of our new national working groups in Nepal, is Pinky Jha. Pinky Jha is a fourth-year medical student at the Nepalese Army Institute of Health Sciences in Kathmandu, Nepal. She chairs InciSioN Nepal and is also a member of the Internal Affairs International team of InciSioN in 2021. She is the secretary of the Walter E. Dandy Neuro Club in Nepal, which is part of the student club, the Walter E. Dandy Neurosurgical Society, who acknowledge that medical students have an immense role in shaping the future of medicine. As an enthusiastic researcher who is interested in pursuing neurosurgery as well as global surgery, Pinky is also a keen learner and believes that learning never ceases.
And it is also with great pleasure to have our next panelist, Anissa Nazar, the chair of Canadian Global Surgery Trainees Alliance. Anissa is a master's candidate at the University of Toronto with research interest in surgical education, simulation, and safety. She graduated from the Royal College of Surgeons in Ireland with a master's in surgical science and practice in 2020 and completed a graduate certificate in global surgical care at the University of British Columbia. Her undergraduate studies, medical studies in Pakistan led her to develop an interest in global surgery and advocating for access to safe surgical and medical care for all. Her past research focused on antimicrobial resistance in critical care in lower and middle income countries. She is a member of the Association of Women Surgeons and has been a communications committee member. She also serves on the Gender Equity Initiative in Global Surgery Mentorship Council and has helped to develop the mentorship program for 2021.
Fantastic. And our the next panelist today will be Erat Mira, the chair of InciSioN Albania. Erat Mira is a final year medical student at the University of Medicine in Tirana, Albania. The national chair of InciSioN Albania is a member of the Albanian Committee of Medical Students, a former activist to Save the Children, which advocates for children's rights, a World Vision volunteer and activist of the town's local youth centre, PYC, which stands for Peshkovkia Youth Centre. Passionate about the art of medicine and surgery, her goal is to help bring the global surgery practices and standards to the Albanian medical students and health practitioners.
Amazing. The fourth speaker today will be Amon Berhan, who is chair of InciSioN Ethiopia. Amon is a medical student at Addis Ababa University, Tikur Anbesa Specialized Teaching Hospital in Addis Ababa, Ethiopia. He is the co-founder and current chair of InciSioN Ethiopia and serves in several organizations aspiring towards global health, such as IFMSA, as a development assistant for Africa. He developed his passion for global surgery when observing the lack of access to safe, affordable, and timely surgical care in low middle-income countries, but also the interventions that could make change.
Fantastic. And last and certainly not least is Abdullahi Saidhashi, the chair of InciSioN Somalia. He's currently a PGY anesthesiology and reanimation in Mogadishu, Somalia. He's passionate about global health development and would like to be part of global efforts to improve surgical care for patients around the world. He also has interest in building research capacity for low and middle income countries, including Somalia, and aspires to be an academic anesthesiologist.
Amazing. And with that, we come to an end of the introduction session, and we will now continue with the next session of our webinar, in which our amazing panelists will have the opportunity to share with us the impact of COVID-19 pandemic, and as well as the response and recovery, mostly focused on the surgical aspect in their respective countries. So I think we will start with InciSioN Nepal. So Pinky, the floor is yours.
Thank you, Rina. Good evening, everyone. I am Pinky Zab, and I'm going to talk about the impact that COVID-19 had in my country, Nepal. Nepal observed the first wave of COVID-19 in March 2020. The government of Nepal responded to tackle the COVID-19 pandemic to the implementation of two key strategic approaches: public health, prevention, and hospital-based intervention. Despite the government's effort in mitigating the COVID-19 pandemic, the crisis has severely affected the healthcare system of the country. Though the government is trying to tackle the first wave itself, the country was hit by the second wave subsequently, which we are experiencing currently, and has brought a rampant situation with lacks of resources, medical supplies such as oxygen, ventilators, ICUs. This led the government to impose the country into a lockdown again to help in breaking the chain of transmission. Amidst the chaos created, the government, healthcare workers, with supports from non-governmental organizations, foreign aids, are trying their best to overcome the situation. Along with that, Nepalese youth have been volunteering through several organizations to help patients in need. The patients visiting for primary healthcare has significantly decreased, and those who have been offered treatments only with the strict adherence to the guidelines provided by the Nepal Medical Council. This has impacted reducing in the institutional birth rates with increase in stillbirths, neonatal mortality, and decrease in quality of care. For surgical cases, all the emergency surgeries are only performed with necessary precautions and the elective cases are rescheduled. Most of the medical attention has been shifted to the management of COVID crisis with a worsened needs for global surgery in Nepal. This has created a huge challenge to rise from the crisis again and strengthen the surgical delivery system as a part of healthcare domain in Nepal. Thank you.
Amazing. Amazing. Thank you so much, Pinky, for showing the impact in your country. And next, I think, will be Anissa. Anissa, the floor is yours.
Amazing. Thank you so much. Thank you for having me. Hi, everyone. So I guess the COVID-19 pandemic, as we all know, has had devastating consequences and has revealed the unpreparedness of systems, really, which include the health, political, and then economic, to respond swiftly and effectively to the pandemic itself. And unfortunately, Canada has not been any different. And you know, when we were hit by COVID-19 last spring, about in terms of surgery, like 36,000 cancer patients had their surgeries delayed in Ontario, for example. And then since then, like the surgeries had only been increased in small increments over the summer, about 6% per week. And then recently in March 2021, we were hit with another third wave, and surgeries unfortunately had to be canceled again. And even though there were reductions across the board, really, including in Atlantic provinces, which had transformed itself into its own bubble, and then also parts of the healthcare system that were unaffected by the virus itself, such as, for example, in pediatrics. Children's operations, for example, fell about 44% in Ontario. That was a steeper, drop than the 34% in adult non-oncology services. And then also in terms of, impacts that we've been seeing, like a lot of them have been on system adaptation, organizations of care, resource allocation, decision-making, and their ethical consequences. And we've relied on rapid synthesis and comparisons of policy analysis to understand the COVID-19 response and their outcomes, but there have still been challenges. And there have been challenges, I guess, like with healthcare workers, like lack of PPE, high workloads, and then also the amount of stress, healthcare workers have faced in an already stressful environment. And then in terms of trainees and medical students, a lot of the medical education, a lot of students were pulled out of their clinical duties, for safety, and then also on to save resources. And I think there will be probably a big gap in, how education, pans out for our postgraduate trainees as well as medical students. And then also, I guess, like in Canada, a lot of the inequities have also been, highlighted in terms of the, various different populations. And yeah, thank you.
Thank you, Anissa, so much for such a detailed elaboration. And our next speaker is Amon.
Hello, everyone. Hopefully you can hear me well. Am I audible, Rina?
Yes, we can hear you perfectly, Amon.
That's great. My name is Amon Berhan. I'm the current chair of InciSioN Ethiopia. And I wanted to say a bit about how COVID-19 affected my nation as a whole. Ethiopia confirmed its first case of COVID-19 on March 13, 2020. 2 days later, the WHO declared a pandemic of this disease. And as of June 26, the country tested about 237,000 suspects, of whom about 2.3% were confirmed positive. And I think right about June 30 is where we saw the curve spiking up and where it reached community spread, and when it was really hard to control the infection rates among the population, because a population of 115 million within a small nation, and mostly people living in a very crowded situations. You can imagine the lack of health access as well as lack of information about the disease. So the country was really pushing on public health containment measurements, and the outbreak still has a potential to have a second wave. We haven't been hit in waves. It was just a slow rise up since the beginning of June. And mostly we saw very immense gaps within the healthcare system, and majority of the time that mostly signifies the OR. So I'm very glad to be here and shine some light on that issue. Thank you very much.
Thank you so much, Amon, for such an in-depth summary. I think next is Erilda from InciSioN Albania.
Hello, everyone. I am Erat Mira, the head of InciSioN Albania, and I'm going to tell you what just happened in Albania during COVID period. Well, COVID entered Albania by March 9, and we entered in total quarantine by March 12. Albania has a small population of 2.8 million inhabitants, and unfortunately, we have lost more than 15,000 lives from March 2020 till now. COVID has been devastating to us, and with catastrophic health expenditures from out-of-pocket money, and we have faced shortage of medical supplies. We now face shortage of medical staff. And as regarding to surgery, all the already planned ahead operation surgeries were postponed, and we only performed emergency surgeries till June. And I just wanted to say that this has been terrific, and COVID has impacted our lives in the worst way possible, even as students, and Albania in overall. So I just wanted to state that catastrophic health expenditure made Albanians poorer, and the situation is that now, fortunately, we're breathing from COVID as numbers have decreased. So that's all from me.
Thank you so much, Erilda. That was fantastic. I think now we can continue with InciSioN Somalia. Abdullah. Abdullah, you are muted. Can you please unmute yourself?
Oh, sorry.
So much. Thank
you. And hi, everyone. Good afternoon. And if I talk about the consequences of COVID-19 in my country is located in Horn of Africa and populated 18 up to 20 million. And firstly, our country has a political instability, which renders and which weakens the health system. So, at the onset of March, the COVID-19, and the government announced that the country will be in lockdown. So, the doctors, there is cancellation of schedule of the surgery, and so as to increase the surge of capacity. There is also a shortage of blood components and mechanical ventilator and ICU, and also there is post-operative surgical care patients who affected in COVID-19 respiratory, mostly in case cesarean section and the pregnant women. There is also a shift of all doctors and more surgeons to the other area, and so as to increase the surgical, and so as to decrease the surgical activity and shift the surgeons to other areas such as COVID centers. So, and also there is an increase of in the first March and the April. Also, there is more panic in the community. So it causes that, and every this respiratory distress case and to be thinking it's COVID until it's tested positive. So that, and also we lost some cases. So in our country, now we are facing the second wave of COVID, and also we are dealing with more cases. Thank you.
Thank you so much to all our speakers, panelists, for giving such an insightful and in-depth situation or presentation of this situation in their countries. And with that, we are concluding this first session of the webinar. And for the next one, I will pass the mic to you, Makinah.
Hey everyone, thank you so much to our panelists for having the courage to come and share your insights and your experience of what you've seen about how COVID has affected your country. I think we hear a lot of the news about how different countries have been differently affected, but I think it certainly brings a different impact and a level of insight and empathy that you can't quite capture when you get to hear stories and insights of this one-on-one from people who are actively experiencing this and have lived through this. Something that I think we all picked up as well from your summaries was there was this emphasis that it was the surgical system that was specifically affected. And I know while the topic of the webinar is looking at how we move forward towards this and how we can recover from this, I wanted to introduce the panel discussion by asking a specific question relating to how surgical systems were affected. Before we do that, I just want to quickly go through some of the panel discussion ground rules, just to make sure that we keep this ethical, equitable, and fair. When we start asking questions now, we will have 5 questions and 2 speakers will be allocated each question for approximately 3 minutes each. If it's not your question you're answering, please make sure to keep yourself on mute. If you feel particularly compelled to answer a question, please flash by going through them on and off. If you run over time, we may have to move on to the next question. But if we have extra time at the end, we will come back to you so you can continue what you're finishing. And if panelists give an answer that anyone in our audience is particularly compelled by, or you have a follow-up question, feel free to put this in the chat. And at the very end, we will open up the floor to our participants and we can answer your questions as well. So continuing in that vein, the first question I have is aimed at Elvida, and after that, Abdullahi. And the question is, how were the surgical systems in your country, as well as your wider region, affected by the COVID pandemic, specifically in relation to research and education? If Rilda would like to answer first.
Okay. Well, COVID found us totally unprepared, especially the fields of education and research. Universities didn't have a platform. We were disinformed and we were without less lections for a whole month, I think. All lessons turned to be online, but the platforms weren't good enough, or they didn't provide the information that we needed. We also were faced with the lack of our professors, because our university is the biggest medical center here in Albania, and our professors are working as doctors there. So most of them were in the front lines of COVID. And as speaking to research, as regarded to research, I can say the research totally stopped nationwide. The only doctors who could have statistics were the ones that were working on the departments of COVID. They even published some papers, and the research program went on only after the situation was a bit better, and other departments could have done some research and are still working on it with post-COVID complications. A big something that is disturbing us students, and that we discuss it all the time, are clinical practices. Because we're lacking them, they have stopped since the beginning of March, and it has put us in a great dilemma on how can we be prepared right on the time when we're doctors. And I think most of us are ready to face and are ready to work overtime or practice overtime when the time comes. I hope that now in the month of June and July, when the numbers are lowering day by day here in Albania, fortunately, even the vaccination process, it's on a good term. I hope that we can come back and reassume our clinical practices. So that's all from me.
Okay, thank you for such an insightful answer. I just wanted to aim the same question at Abdullahi. I'll repeat it as well, just for you so you can have the reminder, which is how were the surgical systems in your country and wider region affected by the COVID-19 pandemic in relation to research and education?
Yeah, and COVID-19 and really affected us too much. In InciSioN Somalia, we are planning to have a first global and surgery symposium, but in the middle of our preparation, and we stopped it because of everything, stopped lockdown and in population يعني can't come around, so we stopped it. So and that affected us and more. So and now we are planning another time to start and to restart our symposium. So and other thing is, and as I am learning, as I am anesthesiology resident, it's normal to have lectures and discussions in the hospital and meet the cases all day. So and after we stopped and as after we stop elective surgeries and normally discussion that affects us and more. And in the middle of the in 2020, and I was working as a anesthesiology in ICU and in COVID center. So I was doing two research and that about the surgery and they're all stopped. So it's affected in a lot of things for me and for Somalia in our country. And the all education system is the all education and centers will be closed. There is no more education. So and that affected a lot of us. And inshallah, we think we be prepared in the second wave. So we are having an online classes and the online webinar discussions. So that affected us. Thank you.
Thank you so much to both Rida and Abdullah for such an insightful answer. And I think we can now continue with the second one for Anissa and Pinky. What were the strategies adopted by your respective countries to maintain surgical services whilst fighting the pandemic? And what do you think the long-term impacts of these strategies would be? I think Anissa, you can go first.
Thanks, Rina. I guess some of the strategies that were adopted by the Canadian health system and the government included one being virtual care and switching over to virtual care, especially in the community primary care practices. That really helped the surgical, the surgical follow-ups, for example. And we had tried to do that before for for northern indigenous communities, but I think now this year actually gave us the opportunity to transfer it over. And then also trying to use the paramedic services to provide pre-hospital care for initial assessment and treatment for individuals in the community, and then transportation between healthcare facilities. And then specifically, we also tried to, especially in the current wave, we had to transfer COVID-19 patients using air ambulance and land ambulance to create ICU capacities in the city, because especially in the GTA area, the Toronto area, we had a lot of people, our ICUs were filled up, especially from, COVID-19, but then also from other injuries such as trauma. And then the other thing we did was to, bring in healthcare workers from other provinces. And that's a big problem for us. Like the healthcare workers, we don't have enough of them. And we had to do a bit of task shifting, especially for surgical residents, for example. They had to be deployed into the ICU. And then also we had an untapped resource of foreign doctors and healthcare workers that unfortunately we didn't really, utilize so much. And I think some of the long-term impacts of these strategies would be, of course, in terms of, security issues with virtual care, trying to get internet access for people, elderly population trying to learn how to use, or access virtual care. And then, hopefully we can transfer over a lot of it to primary care, follow-ups and that sort of things, which will sort of, free up the hospital care instead. And then obviously, when you transfer patients from ICUs, that's very, very costly, but it sort of helped us not make the decisions of, triaging COVID patients and, and some of the ethical considerations around that. And yeah, like, deploying healthcare workers from other places was also a bit risky in case like, those provinces would end up getting a big surge as well for COVID, and then, they would not have enough healthcare workers. So yeah, I think there are like long-term impacts of any of the strategies that we deploy. And I think it's very important to like keep in mind how that'll pan out later. Thank you.
Thank you so much, Anissa, for such an informative answer. And Pinky can go next, but I will read the question once again, just to remind you. What were the strategies adopted by your respective countries to maintain surgical services whilst fighting the pandemic? And what do you think the long-term impacts of these strategies would be?
Rina, thank you for your question. So the additional demand for resources during the pandemic has strained the ability to provide essential surgical services. And the management of surgical patients is done according to the guidelines developed from societies and several countries. The major changes that are observed is in, for example, in the surgical OPDs, patients are treated using in a single room, a single patient is treated by a single doctor. Telemedicine is used in practice as part of surgical OPDs during the lockdown period. Again, in the pre-op setting, a scheme is again used. For example, PCR testing is done compulsorily a week before surgery. However, not all centers follow this protocol. Regarding the staff, intervention was only performed by high experienced surgeons and medical teams, provision of only essential medical personnel in the OR, and with suspension of all the ongoing trainings. TP was administered according to the hospital guidelines, and a pool duty was absorbed, where a surgeon would be leading a team for a week, followed by a next surgeon who would be leading a team for the next week. Along with that, in the perioperative scenarios, the positive pressure ventilation in OR was avoided. Along with that, exclusive avoidance of aerosol generating procedures. Also, the use of filtration and evacuation system in the resource fulfill settings was used. However, in resource limited settings, the alternatives, that is the use of filter connected to underwater seal bag was used. And approximately a delay of about 3 hours was observed between any two surgeries performed in the same OT, owing to the sanitation and fumigation of the OT. In the post-op scenarios, like all the procedures that required interventions like extubations or doffing, they were all done in the negative pressure rooms. Talking about the long-term impacts of these strategies, there is a high chance of getting the surgeries which were elected converting into the emergency surgeries, which might again lead to the high morbidity and mortality in surgical procedures. The positive aspect, however, is that the infection prevention and control guidelines will be emphasized even after the pandemic is over. Training in emergency response management, infectious disease control for medical fraternity will be emphasized. Use of telemedicine in triaging patients for surgery will be taken into consideration. Establishment of short-term emergency packages like immediate response team for any future outbreak is again considered. Along with that, redesigning the clinical resources, increasing in medical staffing, and the practice of evidence-based medicine with an upgrade of surgical armamentarium in all the settings will be considered. I think, yeah, that's about the setting in my country. Thank you.
Thank you so much, Anissa, and thank you so much, Pinky, for such in-depth, insightful, and detailed answers. I heard so many things in there that I was completely unaware of in respect to both your countries. So thank you for giving me a learning opportunity, which I hope is reflected in our panelists and our participants as well. The next question we have, I will aim to Abdullahi first, and then Eamon afterwards, which are, what advantages has telemedicine and innovation brought into the surgical system during COVID-19 that could continue to be part of the system in future?
Yeah, before the emergence of novel and the subsequent pandemic, healthcare system have poor track record adopting digital outcomes. However, in response of pandemic and healthcare system rapidly implemented new tools and many technology based to allow the healthcare system to provide when physical contact is not possible. During the global pandemic, and telemedicine is an emerging and effective sustainable solution to precaution, preventing and treatment and in the stem of spreading COVID-19. Telemedicine is bringing gap between people and physician and healthcare system, enabling everyone, especially in symptomatic patient, to stay at home and communicate with their physician. So through virtual canals, helping to reduce the spread of virus, mass population, and medical staff on the front lines. The second role is there are some patients who have chronic disease who are more susceptible to exposure of the virus. So you can and we can consult in there in the home and treat them accordingly. Thank you.
Thank you. And I'll pass that question to Amon now as well. I'll repeat it as well, just so you have the reminder. What advantages has telemedicine and innovation brought into the surgical systems during the pandemic that can continue to be part of this system in the future?
Hi there, everyone. Hopefully I'm audible again. Thumbs up. Okay, great. Yeah, so I was very interested in this question because I was involved in the telemedicine program developed by not just the surgical department, by the whole hospital where I reside. And the major conflict was that if the patients needed the help that they need, even if they are outside of the city, how would we manage to do so? So because the technology is not infiltrative as we wanted it to be in the community, what we decided to do was to use the technology that we have, which was phone lines, basically, and to use that to our advantage. And major patient communication between residents and seniors were done by using phones and using students as well for workforce to be able to communicate with patients and follow up with them and recording their charts in the hospital, because we were secluded in the hospital and the patients were secluded at their home. But the major impact that we saw with telemedicine was not just patient-centered care, but when it came to consultation, when it came to department discussions between radiology and surgery specifically, which I was involved in, when they were doing Monday morning, ground rounds, those tended to be very hectic when they were physically held. But when we saw being patients discussed online and when we saw how much it's effective when it comes to using Telegram groups, WhatsApp groups, to be able to use those technologies to be able to consult and have our ideas input in place, documented, and to be able to chart them as well. This was very, very an eye-opening situation in which we've continued to use them as OPDs have been opening up. These has been stuck with us and we're still continuing to use them in our daily lives. Thank you very much for the question.
Thank you so much, Abdullah and Ayman, for such interesting answers and for such elaborated answers as well. I'm learning so much from all of our panelists' answers in our questions. I think we can also continue with the next question. Pinky and Erilda, how long do you think the effect of this pandemic will affect your surgical systems in the future, in your future communities? And what should be done to ensure greater sustainability and stability for these types of events moving forward? And how can this be linked to the SDGs? Pinky, I think you can go first.
Thank you, Rina, for your question. Well, we are aware that the impact of COVID-19 is going to be long-lasting, affecting almost all the domains of health sector and with compromises in health sector almost all around the world. Nepal, being a lower middle income country, has a number of constraints with limited resources, and with ongoing political instability, the impact of COVID will not go any sooner, but the consequences might last for decades. The impact of COVID on other facets of health, such as the socioeconomic aspect, negligence and diseases other than COVID, can bring up detrimental scenarios in surgical settings with upsurge in surgical cases in the future. With increase in vaccination rates in our country, we look forward to have a successful vaccination coverage throughout the country, thereby preserving the surgical system that we had prior with the amendments in the surgical delivery system. Talking about the positive aspects, upgrade in the modern facilities with investments in health sector seems inevitable, and the emphasis on surgical systems cannot be denied. This highlights on the potential that we have got for a greater sustainability and stability, which can be implemented alongside as we rise from the crisis created by COVID and lessons learned from it. Also, we know that COVID-19 has overshadowed almost all the developments around the world, but the importance of health system for the development of community, society, nation, and a globe as a whole need not be overemphasized. What we can do is learn from the performance of the country, adhering to the strategies for the management of global threat implementation, as well as a bold leadership with robust governance aligned in support from the stakeholders is immensely needed in the times of crisis and also aftermath. Also, sustainability requires an integrated approach of economic, social, and environmental aspects, therefore claiming a global and a national attention. Integration of telehealth into healthcare system provides a rich opportunity for increased application of global surgery with platforms used in involvement of global surgery as well. Besides, there is no alternatives to strengthening the primary healthcare, and it is absolutely essential to advocate regarding global surgeries in underserved parts of the country and prioritize it in the national healthcare domain. Most of all, adhering to the emergency strategies whilst being consistent with the targets such as the universal health coverage can help in mitigating the compromise in commitment in 2030 agendas as created by the COVID-19. Thank you.
Thank you so much. Thank you so much, Pinky. Erilda, maybe I should read the question one more time just to remind you the question.
Okay.
And to our attendees, how long do you think the effect of this pandemic will affect your surgical systems in the future for your communities? What should be done to ensure greater sustainability and stability for these types of events moving forward? And how can these be linked to the SDGs?
Okay. How long is it going to affect? I think it will take a large deal of time because we already had an overload of patients here in our surgery departments, because surgery here in Albania is mostly centralized here in the capital of Albania, here in Tirana, and we have long waiting lists. But now that we're facing COVID, with the postponing of the operations that were already planned, the load is even greater and waiting lists are immense. And if we don't take actions and learn from all of this, all that happened, it's going to take even more time. We have now achieved the experience, and what I think that it was a positive aspect of COVID was that medical interaction, online medical interaction, was had a boost, and professionals from all the countries started doing webinars, conferences, even free of charge, information fleet. It was beneficial to us students, to young professionals. And I think that, as my colleagues already mentioned, telemedicine is the future, and it will help us to decentralize surgery, mostly surgery here in Albania. And another thing that I think should be very important and should be done is investing in infrastructure, so that we relieve the burden of the national hospital here, Mother Teresa Hospital, and we offer people regional healthcare, so that they can have easily universal health coverage. They can have an immediate approach to healthcare, even tax-free, or it's gonna be less expensive. What's a great thing that happened is that most of countries, high-income countries, had webinars, or have connected with low middle-income countries professionals, and they were teaching and were sharing new aspects and new procedures and informations, and that helped during the pandemic. So this can help even in the future. And I think that sharing knowledge this way, it's even favorable, because as we know, traveling is restricted in these times.
No, thank you so much for those answers, Pinky Milda. They were fantastic. And I thought it was interesting that we kind of touched on topics that we were speaking about in the other questions as well. I feel like it highlights there's a certain centrality and a consensus about key lessons that we can apply not only to a country situation, but in an international context, which I think we should actually probably use in future to inform how we go about shaping global surgery to reflect these attitudes. And that's why it's so important we have these webinars to gain these insights and views. So the final question we have in this panel discussion is going to go towards Amon and then Anissa. And it's going to go in more of a positive lesson. There's going to be talking about if you found there were any positive lessons from COVID-19 that you think could be applied to strengthen surgical systems. Let's start with Amon first.
Hi, everyone again. Yeah, of course. This question brought up the idea of where did COVID-19 play a major role in our healthcare system and how it will look like in the future. And pushing it down to surgery, the major positive side of it was showing us how much strengthening surgical care system within one nation is so immense that if you have a country with a very strong surgical care system, that's practically strengthening the entire healthcare system, because it's at its core. What do we look at with COVID-19? Using PPE, sanitary products, using oxygen and ventilators as wanted. And this is where COVID-19 showed us the gaps we have in the healthcare system. And if you really push forward as a nation and strengthen the surgical care system within one nation, you could really fix the majority of the healthcare system that's broken within our nation specifically. So it showed us how much surgeons are flexible when it comes to practice, and how much they were able to employ their skills, not just to cover surgical patients, but other patients as well, because there was lack in human resources as well, and how much we needed to have more educated surgeons and more subspecialists within the nation. So it's usually, people always say when it comes to COVID-19, it showed us what we didn't see. It showed us the blind side. For example, our nation developed a surgical strategy called the SALTS, which is a safe surgical expectancy by 2030 to provide those needed goals to be met. And SALTS had many gaps, and we didn't see them until now. And if we begin to fill those gaps here and now, I think that would be one of the major historic positive aspects of COVID, because not only would help strengthen the surgical system, but as I've discussed, it would also help in strengthening the entire healthcare system, as we plan to do so within the surgical system. And I think that's the major positive. I can write a book about what are the positive sides of COVID, but I think this is the major side. Yeah, thank you.
No, thank you for that, Eamon. And to be honest, I feel like it'd be good if you did write a book. I'm sure we'd all read it. So the same question that we asked before to Anissa, what were there any positive lessons from COVID that you think can be used to strengthen your surgical systems?
Yeah, thank you, Makinah. I 100% echo what Amon just said. I think that's very true. COVID showed our inequity, our problems, and even ways to figure them out. I think just to add on to that, there have been a lot of things that are better now. I guess innovations in healthcare has really improved since COVID, and again, virtual care, and how do we want to access or improve access to healthcare in our rural and northernmost communities that are really far from distance. I think the other thing is that, COVID sort of made a really big prominence on what is essential. And I think in our healthcare system in Canada, there are a lot of things that are unessential and, not very necessary. And they sort of, bog down the system really. And I think for us, that's one of the main lessons. And then also improvement in like population health and like a more focus on preventative medicine. The fact that, you know, we had public health measures, it decreased like number of flu patients, for example, you know, really decreased the burden of, you know, hospitalized patients from pneumonia, that sort of thing. And then also, I guess from a trainee perspective and a you know, the surgeon burnout perspective, like there are more availability of supports. It's becoming more normal to talk about the stresses that, you know, healthcare workers face. And then also in terms of training, you know, using simulation as a training method, that's also been very, very positive. And then lastly, I would like to touch on a little bit about the research collaborations. I think COVID Surge, for example, from UK was such a wonderful study. And the fact that there are many collaborations that actually came out from, you know, from COVID and surgical collaborations, and then also like between a North and the South, you know, and I think it really just leveled the playing field, in my opinion, and hopefully we can, you know, use this as a leverage to improve healthcare systems around the world. Thank you.
Thank you so much. And I'm slightly sad to say we've just reached the end of the panel discussion, but luckily we did get some fantastic questions now from our participants, so we'll go towards that. Just one little rule is, yeah, if you feel particular, we're going to read out some of the questions, and if you would like to go for it, it's first come, first serve. Simply just unmute yourself and answer the question, and then we'll move on to the next one, and we'll go that way, and we'll just quickly summarize this webinar. Unfortunately, we'll probably have to end, but this has been a fantastic experience. I think I can speak for everyone there. So, Rina, do you want to start with the questions?
Yeah, sure. So the first question that was written in the chat: how should governments envision the surgical systems in the post-pandemic era, especially in the context of policymaking and SDGs? Who would like from our panelists to answer the question or give maybe a short insight on this because of our time restrictions?
If no one else will take it, I can answer the question. I have an opinion on that one. So I speak in the context of the UK, where our healthcare system is nationalised, and it's generally the funding and the allocation comes from the government associated with reform. So the idea of that is to give inequality, and the NHS's main point is free to the point of access. However, what we saw with the surgical system within this system was that because we had to prioritize the fact that it was like the study of medicine, especially in the respiratory context, we also saw a redistribution of our surgeons being sent to medicine wards because they needed more numbers there. And because of that, the wait list in elective surgery, like the wait lists of that have increased not just in the UK, but globally so much that there are questions about how we can make that possible. Now, that is one context, and something else to add context in terms of medical education in the UK is that there is more of a push towards general practice psychiatry and less of an emphasis in our medical curriculum towards surgery. So much so, in fact, that in my medical school, we don't actually get a specific surgical rotational placement. It is normally something that you have to seek outside yourself in terms of your extracurriculars or to find mentors. So something that I think that should be done in regards to policy making is because we're going to have increased elective lists. I think this needs to reflect that we need an increase in training in national training numbers for surgery, and we enhance surgical training not only in our surgeons, but we increase at least basic surgical skills in the medical residents and the part of the community to start tackling these. I think there needs to be redistribution in how we allocate our elective lists, and looking at recontextualizing which factors make someone much higher risk for different types of side effects, and splitting those up regionally as well, because there's areas in the country that have different population densities, and we need to redistribute that somehow. Otherwise, there can be certain areas, such as the large cities, that will have these backlogs of lists for much longer compared to like towns and cities. But even then, the density of healthcare services there are less than they need to be. So I guess in the context of SDGs, that runs into quality education, SDG 3, healthcare naturally, so SDG 3. But I think this also links with ideas of poverty and sustainability, which I think are two, and one that is in the teens, and I can't remember on the top of my head. That was my answer to the question.
Definitely agree, and I second your opinion, Makinah. I couldn't put it better. I definitely think that the best approach would be through approaching the 6 surgical indicators. And when we speak about surgical indicators, I think the surgical volume and the density of surgeons in a region would be very important to keep in mind as a goal for the post-pandemic area. As you mentioned, that would be very much fulfilled through education, through innovation in education, and that would definitely be linked with SDG number 4, quality education, but as well as SDG number 3, good health and well-being. Another aspect that, of course, pandemic has had a very big impact, unfortunately, is the economic aspect of every country, I think, in the world. So another surgical indicator that would also be linked to this would be the impoverishing expenditure. So I think stakeholders all around the world should keep in mind and definitely take care more or have in mind this part, that also and give not only an impact on the economic aspect, helping the people, but also on that way that would make an impact on the SDG number 15, life on land, and no poverty, which is SDG number 1. So I think, Makinah, do we have time also to take another question?
Yeah, I think we do.
Okay, great. So I think the second question was, is there any COVID positive patient that needed an emergency surgery in your country, and how did you deal with that patient?
I'd like to answer this question.
Yes,
Yeah.
go on.
There were obviously COVID positive patients that needed emergency surgeries. And as I said earlier, there was a particular protocol that was followed to treat for the COVID positive patients. First of all, adequate PPE for all the surgical teams and also the other medical staff was ensured, that comprised of, the accessory wearings and etc. Along with that, the COVID positive person, if possible, would be, kept in an isolation ward for about a week after testing. But if it required an emergency surgery that could not be withheld for more than a week, the emergency surgery would be carried out with all the necessary precautions. And in the operation theater itself, the positive ventilation would be avoided and use of all the negative pressure ventilation. And along with that, proper sanitation and decontamination of all the medical equipments would be done. For example, covering the instruments with plastic sheets wherever possible would be used. Along with that, exchanging and discarding of any chemicals that were used in the treatment of the patients would be done. For example, discarding the canister containing the soda lime in anesthesia and stuff like that, that would be considered. Along with that, in the post-op period, the person would be again isolated in a separate room, and the isolation would be done for at least 14 days to ensure that the person tends to become negative after the surgery has been done. So that's how COVID positive patient received an emergency surgery in my country.
Fantastic. Thank you so much for answering that. I think we just have one final question to get through, and then we'll have to quickly summarize. So this question is, in the lack of context in terms of leadership and major difficulties, one of our participants would like to hear what your thoughts are about what youth-led organizations can do in regards to strengthening healthcare systems.
Hi, I'm happy to take this question. Yeah, this is a great question. Also, I think youth-based organizations, especially in global surgery, have been so instrumental in leading change, and not just in surgery or global surgery, but also like, you know, based off of like medical students and schools and, you know, like providing advocacy. I think it's so important to, you know, continue this advocacy. I think, you know, for example, like the World Health Assembly, you know, and InciSioN representing at that organization is so imperative, to say, you know, how important healthcare systems are, how important surgical systems are, and what's the benefit of that. I think, you know, we have to sort of, especially if you're interested in surgery, we have to sort of advocate, you know, our jobs in the future. Like, why is it that the world needs surgeons, you know, and why is it that we need like highly trained healthcare professionals, you know, to lead these changes. So I think what we all have been doing, I think, has been brilliant, and I think we should just continue with that. But then also, like, I guess in terms of, you know, healthcare services and developing systems, I think it's important as medical students to seek out education, if it's possible. And I think that's like where the challenges are, you know, doing, you know, like higher degrees, even like, you know, trying to find, you know, online education that, you know, teaches you how healthcare systems work, what are some of the nuances, and then also becoming a little bit more, you know, like trying to dabble into the multidisciplinary things, like, you know, the business administration parts of it or the economic policies part of it. So, and I know, like, from a student perspective, people used to say that, you know, as an undergraduate student, and you need to be able to do just pre-med to go into medical school. But I think that's so important when people come from various backgrounds, various diverse, you know, countries. And I think the diversity really will help us in the future. So yeah, thank you.
No, thank you. And I think with that, there are a few questions in the chat, and our lovely panelists will probably be typing them, so you can get your answers there. And if we run out of time in this webinar, feel free to start writing those answers on social media. Go to Twitter, Instagram. I'll post the hashtag that we're using again, so you can follow the discussion there. And if you've got any follow-up questions, I recommend you can contact our panelists directly as well. We'll post their socials. Just keep an eye out on the InciSioN account. We've tagged all from there. So with that, I think we need to actually start concluding the webinar. What do you think, Rina?
Yes, I definitely agree. We have come after such a fruitful discussion in the webinar. First of all, I want to thank once again all our amazing panelists for sharing their in-depth presentations and their summaries of their situation in their countries. I am sure that starting from myself, Makinah, and all the attendees have had the chance to learn a lot about the impact of COVID-19 pandemic in all corners of the world today. So I'm very happy for that. And I think that the best way to maybe conclude this webinar would be to maybe mention some key takeaways that we have learned today. On my opinion, definitely the surgical system is has limitless space to bring change and innovation. And definitely the COVID-19 pandemic, it has been a new situation for all surgical systems around the globe. And no time better than during the pandemic have all the stakeholders, the governments, the doctors, even the students been put in such a position to think out of the box and to find solutions to such a new situation. And that with itself has brought innovations and a lot of methods that you also mentioned in your respective countries that were happening and are still developing. And I am really hopeful that when this pandemic ends, we will be left hopefully with the positive aspects. We will have new methods and innovations, not only in our surgical systems, but also in our education system. And moreover, this time of pandemic has taught us more than ever that we should work together, and only through partnerships between countries all around the world we can reach the common aim of universal health coverage. And especially with the vaccines, we have learned the importance of equity around the world. So let's hope that this pandemic has made us better advocates and has helped us to understand the importance of universal health coverage and the importance of every individual to take an action in fulfilling that goal.
Thank you so much for that, Rina. And I think in a similar vein, I think the key takeaways that I've taken from this webinar, and I think from the pandemic in general, are, I think it was both a blessing and a curse in many ways. A curse in the sense that our medical education, our research experiences, how we thought we were going to enter the world as doctors has been completely changed. But I think in the same vein, I think the pandemic highlighted issues that were already there. It just brought them to the surface in a way and a manner that is so kind of there in the sense that we didn't expect. There's always been inequalities in medical education. There's always been inequalities in our resources, how we access that, how we interventures and partnerships between HICs and LMICs. And I think when this was laid there for almost everyone to see within the medical community, but outside of it as well, I think it's actually the point to highlight this to us as the future of the medical profession, but also to empower us to see that there is issues. But luckily, because we've seen them so early on in our careers, we're actually in a place where we have time to develop strategies, develop skills, and understand the implications of why we need to tackle this. And I think that is the biggest blessing of this pandemic. We see all these issues. We have to experience them. We see our family and friends going through them as well. I mean, I'm sure you guys will notice, I completely understand the distrust people have towards the medical community because of the vaccines. They're not believing us about even wearing a mask. That's something to tackle. Then we see the implications that social media can have and telemedicine has in both good ways and misinformation, to how we have to reorder the administration policies in hospitals and how they do it with wait lists. And I think the key context is we have time. The pandemic is still new, and we're going to have to live with the impacts and the effects of this for a long time. But we do have time, we have the skills, we have the resources, and importantly, we've got the tenacity and the motivation to try and solve these issues. And that's the blessing of the pandemic. We can really reform healthcare moving from this. Sometimes you do have to hit your lowest points to improve that and go beyond that. So I think that's been the key takeaway. And even though it's been over a year now, and it feels surreal to say that, and we're getting a little more desensitized to this news, it is important that we remind ourselves about this so we keep understanding why we need to keep pushing forward. At least that's my key takeaway. Thank you so much to everyone who has agreed to speak, who's come here today, to the panelists. And yeah, no, I'm honored to actually be here to moderate. It's been amazing to hear everyone's insights and your lessons.
Definitely. Thank you so much to our panelists and to the attendees for their questions and for their presence here and for the questions. It was really something that we learned and a new experience for us all. So with that, before we close this webinar, I would also encourage everyone to continue and be part of the activities that InciSioN has worked really hard to bring for Global Surgery Day, but we are celebrating it in a week. So please be part of activities that are happening tomorrow. We have another webinar. We will have Twitter chats, Clubhouse discussions, Journal Club, and Instagram Lives. So please take part in those activities and share your experiences, share your thoughts, and feel free to post on your social media and use the hashtags, hashtag the future of the ER, hashtag global surgery, and hashtag surgery for SDGs. Thank you so much one more time to everyone.
Thank you.
Thank you so much.
You.
Thank you, everyone.